Very good morning. Firstly, what happens next?
Good morning.
Tell us about these irregularities.
No, I think it was just a lot of allegations around nepotism, and it's not for the first time that this has been actually coming up. And we know that there's also a lot of scams that have been going around the Garankuwa area involving George Mukhari. And we just thought that we need to focus on it and zoom into it, because corruption is one of the biggest problems and challenges, and we need to be very much responsive to it, to actually nip it in the bud.
All right, tell us a little bit about the scams that have been...
there are people who actually sell jobs, there are people who promise others, and this nepotism, it might look like it's families, but it's people who have been pre-arranged and maybe probably have paid for the post. But we have put up a team that is going to look at the allegations properly, a high-level team from our HR team from a provincial office, just to come in there. But also, we felt that we need to change leadership of the hospital, because that's one part of a system that gets faulty and everything else gets faulty.
All right. Can you give us a sense of how many people are involved in this scam inside and outside?
Currently, I might not give you the numbers, but we have actually zoomed into the HR department in the hospital. We have also deployed our high-ranking Deputy Director General to become a CEO there for the next coming 2 years to 3, just to stabilize the leadership, because the hospital itself has been marred with this type of allegations from last year, and the community has been raising with them, and we decided to take note and also to be responsive and be probably accountable and transparent to the community itself.
Okay, so what type of person has slipped through the net?
We are not talking about health professionals, let me assure you and be clear about it. And also with the stopping of recruitment, we have not stopped recruitment particularly of health professionals, because some of the recruitment is done and controlled from the district and provincial level, because that's the part that we need to be rapidly filling and actually creating those and filling all those vacancies.
So what departments were mostly affected?
Mostly it's general work, your porters, your cleaners, and your clerks. It's most of them, it's that type of job that we're talking about.
How long is the cleanup process, do you think, going to take? And when are heads going to start rolling?
The aim is to finish the process in a month's time, because we also need them, the essential part of the system when you talk about cleaners and you talk about porters. So the team has been there for the past week or two, and we're hoping to get results in the next week, and then we'll act on that.
Tell us what sort of impact it's had on the hospital and morale there.
The morale is bad, that's why we also had to just shake up the issue of leadership, to provide a better person who will be able to understand and help us. That one of our bigger priorities as the department is just to raise and motivate our staff morale. And this is part of it, just to give confidence to the systems.
I mean, you've got to assume it's happening at other hospitals. Is there some sort of better screening process that needs to be rolled out throughout the country?
We have essentially zoomed into HR, for the past 8 months that we have been, and we have now also in an employ of a new Director General, Human Resource and Corporate Services, who's going to help us to clear up and clean up the whole system. Our HR system has been a mess, but I'm getting a sense now, since he came on board, that we will actually be able to sort it out as we go forward.
Bandile Masuku, thank you very much for coming in.
Thank you so much for having us.